So today marks 332 days since our first case back on March 12th. 323, sorry. This is week 46, and sadly we lost another county resident to COVID-19, a woman in her 50s. This brings our death toll to 304 Albany County residents that now have passed to COVID-19. My thoughts and prayers and condolences go to the family and through these difficult times. Again, like I said, it's difficult enough to lose somebody in a normal world, but the new world that we're living in, to have to say goodbye to somebody and people can't get out, it's tough. Just like Congressman Tonko's mother passing away, and I'm going to that after this, and Steve Aquario's mom, and it's a hard time. And my prayers and thoughts go out to all the families. There are now 18,009 cases of COVID-19 to date, 171 positive cases since yesterday. Our 5-day average is 176. Yesterday it was 180, so we dropped a little bit. There are currently 2,966 people under mandatory quarantine. Yesterday that number was 2,611. Of the new positive cases, we also know 49 have had close contact to positive cases, 10 are healthcare workers, and 1 had travel, and 111 don't have a clear source of infection at this time. As of today, there's 53,256 people that have now completed quarantine. 16,459 were positive and have recovered. That's an increase of 6 recoveries since yesterday. Unfortunately, the thing we continue to watch is the hospitalizations in the ICUs, and we have 13 new hospitalizations overnight. Currently, there's 162 Albany County residents that are hospitalized. 11 patients are currently in the ICU, and that stays the same since yesterday. Again, broken record. We need you to do your part. We need you to wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and we'll get through this. And we'll get through this together in a partnership. For those who want to get the vaccine or check their eligibility, please use the state's number, 1-833-697-4829, and our great partnership with Pete Gannon from United Way, the 211, which has been a huge success around the state of New York. Not just here in the capital region, for people just navigating that web, because it is difficult, and it hasn't gotten any better. So we're hoping a website we set up the other day, we have improved on it. It's going to be better than it was the first time. So I'm very happy with the way it's rolling out and making it simple. Also having a number for seniors to call to sign up, so they don't have to go on the website or play the Hunger Games and be quick on the computer. I always joke around, I got challenging little fat fingers, so it's tough enough to navigate your phone and let alone Assemblyman, that's, and I'm just saying that. But again, it makes it difficult, right? And you have to be patient, and we have to help people that are not quick to navigate the computer systems and go forward. So please, be patient with all of us. And again, thank you to United Way, and we're here for a couple things with United Way. And I like to say I'm getting tired of you, Peter, but it's been a great relationship for the last 11 months. So thank you to everything that you're doing. So to touch just a little bit, I know the fate of sports has been on the minds of a lot of people. So the people come down to protest tomorrow, please let me know. I'll bring you hot chocolate and donuts. Do it socially distanced, wear a mask. I get it. I know you're upset. I'll be there with you. I get it. This got thrown at us on a Friday afternoon at the end of the day. And you know what? We tried to do our best. And my hat's off to Dr. Whalen, to all the commissioners in the Capital District that had to make this decision. And this decision wasn't based on politics. I said this, I'm not here to get your vote. I'm here to get your people through this and try to save as many residents as we can to go forward. If that means I have to make unpopular decisions, then so be it. I'll deal with that. But I have to sleep at night. And I've said this to you before. I have to put my head on my pillow, and I have to make sure I did everything in my power to save someone's life, not gain someone's vote. So we based it on that. I stand by Dr. Whalen. It was sole decision of the health departments, but I'm standing with them. You know, this is about the science. This is about the data. It's not about the politics, okay? So I want to make that clear. So I do stand with them, and all the other counties did. One went a certain way, and that's fine too. Every county did it. Washington County, I think, bowed out altogether, but every other county signed off on 4% across the board. So again, it's tough, but I just want to give you some statistics here, and bear with me. I know a certain show likes to beat me up if I say something wrong, but I want to say this clear. From March to September of last year, in a 6-month period, we had 331 Albany County residents hospitalized in the county. During that time, we lost 134 people to COVID-related deaths. This second wave being worse than the first wave. Now, this is just a 4-month reporting period. From between October of last year until today, we've had 1,059 hospitalizations and 169 deaths. It's worse than it was in that 6-month period in these last 4, and it's only getting worse. I will assure you, more people are being hospitalized, but more people are, yes, to the non-believers, yes, they're walking out. My brother got out of the hospital, but I can assure you he did 5 cocktails before he got out and to the point he could be released after having COVID-19. If that happened to him in that time period before, he would be dead. The only thing that saved him is that new cocktail that they're putting out, and the hospitals are treating this differently because they got more tools in their arsenal to help patients recover and beat this and get out. So we have to base it on that. And again, one of the things I've noticed too was the 50-year-olds that have been passing away with this COVID-19. In May of last year, 50-year-olds made up 2% of all the deaths that month. In December, they made up 14% of the deaths in the month of December alone. So when we made a decision on sports and participating in school sports, we also need to consider the health and safety of the parents and the students. We got schools that aren't even back. I want our kids back. My daughter hasn't been back in the classroom since March of last year. March. Obviously, she's really enjoying being at home, so she's probably mad at me to advocate to get back in the classroom. But we want kids back in the classroom. So my obligation is to get the kids back in a safe manner before we play sports. I had to spend probably 30 minutes of my life when we was making the decision to my nephew, Hagen Foley, and I'm going to call him out, plays basketball at CVA, wanted to kill me. Sent me a pretty bad letter too, Hagen. I'm going to save that for the rest of my life. Arguing the point of why he should play basketball, right? And I had to tell him and read him the report that the health commissioners put together in a partnership. Every health commissioner put this in a partnership together and came up with the guidance. I don't think he understood, but I think he was still mad at me, but he kind of said he understood, and he said he still loved me, so I appreciate that. But, again, it's not about winning votes. It's about the health and safety of the people that I'm in charge of to make sure I get you through this. And trust me, it's been a long 46 weeks around the clock. My staff, to the health department, to all the essential workers in Albany County, especially our county buildings, thank you. And to the doctors and nurses on the front lines, thank you. I want kids to have normalcy. I know the mental health issues they're having and struggling and not being with kids, but we're almost through this, people. And then when you look at when the governor's announcing that in March could be deadlier than any other time we hit. So I was a little confused because I sat there and I go, okay, if I'm having a deadly December and January, and now they're saying this next strand that is here now is going to be worse in March. What are we giving hope for? Why are we telling people we're going to do this? Knowing that let's stay vigilant, let's stay strong, let's support one another, and we'll get through it working together. Not pointing fingers, getting mad why I can't do this and why I can't do that, but working together in a partnership and supporting one another. Just like I said, there's people that won't wear masks to this day or believe it's not real, right? Or the Democrats shut down when Trump was there, and they're going to open up once Biden's in office, and look, the Democrats are opening up everything, and they shut everything down. Yeah, the numbers were a hell of a lot better 11 months ago when we were shut down for 4 months than they are today. But that's not my call. I have to work with my health commissioner. I have to work with my Department of Health, DOH, federal government, state, to make sure at the end of the day we do what's right for the people. And only control what I can control. You want to change the rules? I'll adapt. It's just simple as that. We will meet any standard they throw at us. And unfortunately, this one was thrown at us, and we did our best. And we're not saying no to sports. And I said to my nephew, go talk to your principal and your basketball coach. Modify the season. It doesn't have to be November to March. Why can't it be March to June? We're hoping by mid-February we get there. But again, looking at our charts, You know, we're 6% in the capital region overall. But our infection rate yesterday was 6.1, which was good. But we're at 6.9 today. And I'm saying to parents, you know, we will get there when we get to 4%. The school's got all their guidance, what they need to do to play sports, and we'll do it. One of the schools, Academy, they got a less than 1% infection rate because they test 100% of their students. I said, you know what, Brian, it's a great point. I'll give it to my health commissioner and see what she says if you can just practice because you're at 1%. There's wiggle room in there to work with everyone. I want kids to feel normalcy. But until these numbers go down, we can't get there, you know? I mean, 6.9, 6.9. If you look at Rensselaer, Green, 6.8, Rensselaer, 5.7, Saratoga, 6.0, you know, Schenectady, 4.9, which they dropped. Rory Foreman must be happy. And I can go on and on with everyone. Educate yourself, look at the numbers. It's based on science. I don't want to sit here and tell parents no. We didn't say no to sports. We just said, do your homework. When we get there and we're all in this together, and you stop this infection rate, we can all get together. You can play sports. So my challenge to all you kids out there and all you coaches that just are focused on playing, think about the kids. Think about the parents. Just don't think about the game. And we'll get through it. You know, we'll get through it, and we want to work with you, and I'll work with any ideas that you have to come up with, and we'll adjust. But you got to educate yourself first and foremost. So please look at the New York State dashboard, look at our dashboard, do your homework. Just don't hear that all you heard was we're opening up February 1st. That's all you heard. You owe it to your kids that you coaches, to educate yourself and make sure that you know the science and the statistics behind it. That's all I'm asking you. Be in this as a partner, and I'll be there as a partner. And when that infection rate, and I hope by mid-February or March it comes down, we open up. I want to be open. But the reality is the numbers aren't showing that. Our infection rate is terrible, and to the families that continue to fall to this awful disease. So, enough of that. I have said this. You can look at the map. Mary put up the states that have opened, have not opened yet to high risk is up on the screens. Please, we need everyone in the community to get testing. It's our priority. We want you to do it. The partnership with Whitney Young, you can get it done through Whitney Young. We pay the insurance. We pay for it if you don't have insurance. 518-465-4771. And Albany, as always, you know the numbers. Go to our website, albanycounty.com. It lists everything. And please, educate yourself. Please, go there. You can find out what age group your child has to be in if you want to get them tested, and so on. So you know the drill, said it enough. But today, I have several people here to launch the cash collection of the greater capital region, and great partners that are here today. And I do like to joke with Assemblyman John McDonald, who's doing a great job, and you've been a great partner, you and Pat, and Dale have been a phenomenal partner through this whole process for the last 11 months. And we joke because for some reason, I don't think we look alike, but everyone says we look alike. And you know, it was nice. I always joke with John. Some lady came up and said, "Hey, you're doing a great job, and I can't believe what you're doing." I go, "Thank you. I really appreciate that." She goes, "But I liked it when you were mayor." I go, "No, that was John McDonald." You know, and but it was nice. It was nice, and to Jenny Hyde from the Catholic Charities of the Diocese of Albany. It takes everyone to work together. And the one thing I do love about being county executive is the partnerships that you form, the relationships that you form, and working together for the people, because the common goal is really to help everyone at the end of the day. You know, and I was going through my notes, and they had the COVID-19, you say Vita? Vita. I was like Vita because it's the same thing, and all I could think was my brother-in-law Kevin Vita. I'm like, there's no way he did 6,363 returns and put $15 million back in the economy. I'm like, and now she's like, Vita, it's Vita. I go, all right, I'm thinking Vita, but you know, but again, it takes people like that to do extraordinary things and to help people, and even through the COVID-19. You know, like I said, it put $15 million back in the local economy. And here to talk more about this is our great partner from United Way, Pete Gannon. Please, Pete.
Thanks, Dan. And let me also say, every one of us in this room owes Dan a huge debt of gratitude, because up until, and Mary Rozak, who works behind the scenes here, because at 3 p.m. yesterday, the plan for this event was to have it out in front of the building at Catholic Charities. So we appreciate you accommodating us and allowing us to move in here inside the warmth with the real frigid temperatures. And what I'll also say is Assemblyman McDonald was an RSVP, yes, even when the forecast was 10 degrees and we were still outside. So you get full credit for being here, even in the warmth of the indoors. Tax season's here. That may feel like more bad news to some people, but this is actually really great news. The partnership that we have here regionally with the Cash Coalition, with United Way, Schoharie Community Action Partnership, Mechanicville Area Community Service Center, YWCA of Northeastern New York, and of course Catholic Charities, represented here today by Jen Hyde. We're kicking off the free tax prep program for the year. Today is Earned Income Tax Credit Awareness Day. The Earned Income Tax Credit, as many of you know, is probably the most tried and proven effective government tool for lifting families out of poverty. And as we're concerned at United Way, we talk about ALICE all the time, Asset Limited Income Constrained and Employed, lifting families, children above that ALICE threshold. So we've got some details on how things are going to be different this year to keep people safe, to keep people healthy, but also connect them to that expert assistance for the IRS. So let me give you just a couple of bullets, and then I'll hand it off to Assemblyman McDonald, and then Jen will talk a little bit about how the process is going to change this year. Since 2018, VITA program, over 800 volunteers have completed nearly 28,000 hours of volunteer service, facilitating almost 37,000 tax returns here in the Capital District. Those 37,000 returns returned $56 million to the Capital Region economy. 12 million of that is in the Earned Income Tax Credit. In addition to that, there's so many people out there now who talk about free tax prep. Hold on to your wallet when you're talking to those people about free tax prep, because you're going to get 80% of the way through your process and find out there's a fee for the state return, or there's a processing fee for this. At VITA, when we say free, we mean free. And these filings in person are free for anybody under $56,000 a year in income. We expect, because of the pandemic, that pool is going to be significantly larger this year. IRS certified volunteers this year will be, Jen will talk about the process, but part of the challenge with the Earned Income Tax Credit is that you have to earn income from various sources, and there may be people who struggle with that in 2020 as a result of the pandemic. So I mean this sincerely, in their wisdom, the federal government has allowed one-time look back to 2019 income levels for the purpose of generating your Earned Income Tax Credit. So that could be complex. Great thing to talk to one of the IRS certified volunteers about. The other thing the volunteers are trained to do is look back and make sure you receive the appropriate level of stimulus funding as passed into law by the Congress last year. So if you have questions about that, I never saw the money come into my, there was a lot of confusion about the direct deposit and the checks, and am I eligible, am I not eligible? The volunteers are going to help you look at that and get a definite answer and make sure you get what you were supposed to. Last year, the federal government made VITA permanent just before the pandemic set in, so that's going to enable us to build on this program for years to come. What I'll say before I hand it off to the Assemblyman, the latest stat we saw this morning from our partners at Prosperity Now, 1 in 4 families through this pandemic have skipped paying a bill. Which I feel somewhat sad to say, I thought was actually low. I thought that number would be higher, but gives you an indication of just how badly some families are struggling right now. And this is a little ray of hope for those folks who are trying to get through this situation and do it where they get the money that they are entitled to, without exorbitant fees, without the hustle and bustle of these same-day refund scams that charge exorbitant rates. So with that said, to speak more to the success of this program, I'll hand it off to our Assemblyman, John McDonald.
Well, thank you, Peter. And Jen, it's good to be here with you as well, but also to Dan McCoy. Thank you for your leadership during this time. It's very interesting. It's always easy to tell people yes. It's never easy to say no, or we have to wait. And this pandemic has been, as we all know, very trying on many aspects. it is driven by science and facts, and you have to stick with that first and use that before you make decisions. So I give you a lot of credit, Dan, for that, because it's not easy. But today we are talking, actually, as much as we live in a divisive world, today we are talking about a program that actually works, that everybody, no matter what side of the aisle, whether you're on the far left or the far right or right in the middle, we all agree with this. Individuals who go out and work every single day deserve the right to get this earned income tax credit. This is a program that I have supported for several years, that everyone supports, because it's government working the right way. Today our county executive is hosting this event to talk about this program. The same token, we have great organizations like the United Way that we fund at the state level to operate programs called 211. The easiest way for somebody who has a question about EITC is to dial 211. Plain and simple. We also have great organizations that we support at state level, like Catholic Charities, which have multiple areas that they work in. They put together the Volunteer Task Force, the VITA program as it's called, to help individuals have a trusted source to be able to get their income tax form completed properly, and as Peter has pointed out so appropriately, to make sure they haven't missed anything else. Let's face it, we know daily in life, many things fall through the cracks. There's no doubt in anyone's mind, a lot of things have fallen through the cracks during this pandemic. And thankfully, programs like Catholic Charities, like United Way, are there to help make sure any individual earns everything that they've earned. The other thing to mention, I know Jen will mention it, but this year, more than ever before, it's going to be done safely and appropriately. And with that, I will thank everybody and turn it over to Dan. Thank you.
Jen?
Thank you.
I can before you jump in, Jen. Let me just I'll tee it up for you here. The Assemblyman mentioned 211. That is open now to schedule your appointment. A couple other things you can do as well. You can go to getfreetaxprep.org, getfreetaxprep.org, and book an appointment online there. You can also, there's several other sites you can call directly and make your appointment. Here in Albany County, those sites are ACAP, Catholic Charities, Trinity Alliance, and the University at Albany. In Rensselaer County, CEO, Hoosick Falls VITA, Troy VITA. In Columbia County at Columbia Opportunities, Greene County at the Greene County CAP, Saratoga County, Ballston Area Community Center, Captain, I mentioned Mechanicville Area Community Service Center, and LifeWorks. And in Schenectady County, Union College and YWCA of Northeastern New York, and our partners in Schoharie County at the Office of Aging and at their Community Action Partnership. You can call 211, getfreetaxprep.org. If you don't meet the $56,000 income requirement, or you're awfully savvy with the technology and you make $66,000 or less, you can go to our site that is a partnership with H&R Block called myfreetaxes.com, completely free. You can file without any additional assistance. Normally, this process is individual brings in their return and they sit with the IRS volunteer. We had to shut that down in the middle of March last year as a result of COVID. We're still not back to the point where we have that high comfort level that we can offer that. Jen and our partners have worked really hard on designing a system that is safe, secure, will keep everybody healthy, including our volunteers. So let me hand it off to Jen from Catholic Charities to talk a little bit about what that process is going to look like.
Thank you, Peter. County Executive, thank you for having me here today. I will tell you that for people that are driven to work to help those in our community, when the pandemic hit us in March and we had to shut down our in-person volunteer income tax assistance program, it was hard for everybody. It was a really tough pill to swallow. We knew going into this year that we had to find a way to do taxes. It's too important. You've heard the benefits that everybody has laid out before me. Now more than ever, every dollar counts in our community. So I'll tell you, Catholic Charities has run a VITA program for 20 years. We found a way to run it for 21 years. With our partners and a great deal of hard work, we have found a way to do taxes virtually. So we have very experienced volunteer tax preparers who are trained and certified by the IRS, who will be at home and with a safe device, keeping all documents secure, preparing taxes. So we have 2 key tools to help us do this year. One is the virtual platform, getyourrefund.org. With that platform, people will have the ability right from home to enter their information, upload their tax documents, and it will then get assigned to one of our volunteer tax preparers. Taxes will get prepared, questions will be asked to the taxpayer, and they can get an email, a secure email with their documents and file their taxes. Good to go. We know not everybody has the ability to scan their own documents and to upload their own information. So at Catholic Charities, we thought out of the box a little bit. And we will have appointments scheduled at our parking lot at 40 North Main Avenue in Albany, where we will have our CC Move RV available, and we will have an incredibly important device, a portable scanner, that will upload documents for people. We will explain the process to them. We will make sure they're comfortable. We will follow all CDC guidelines and regulations to minimize the risk of exposure to COVID-19. It's that important. So how do you do it? How do you get your taxes done in this manner? Call 211. We will have appointments available for folks to schedule their time to come in and have their documents scanned at our CC Move RV, or go to getyourrefund.org and start your process there. It'll be that simple. I will tell you that there's always questions about taxes. And you've heard some today. What do I do about my unemployment income? What do I do about my stimulus check? Well, at 11 o'clock this morning on Facebook, we'll go live with a virtual panel of tax experts. I'll be moderating, and we have an individual from Legal Aid Society and one of our lead volunteer tax preparers who will be there to answer your questions. I hope you join us, submit your questions, and we are happy to answer them. Thank you.
Thank you, Jen. And thank you to Pecan and United Way, Catholic Charities, and to our great partner, Assemblyman John McDonald, who I do want to say does own a pharmacist. He is a pharmacist, but he has been, besides this time, I can only imagine the challenging times you're having at the state government and assembly, his nights and weekends out giving shots and helping other pharmacists get shots into arms of people. And John, I commend you for that, and helping coordinate and volunteering your time when I know how precious your time is, and you're wearing multiple hats and you're doing it well. So I do want to say thank you to that and to all of our partners, because again, I know someone says, why do you say partnerships all the time? We'll get through it in a partnership. We'll get through it not pointing fingers. We'll get through it by not arguing. We'll get through it by taking a step back and realizing it's a marathon, not a sprint. And we gotta what? Crawl before we walk and walk before we run. And we're just starting to walk. So we're there. The light's at the end of the tunnel. But it's gonna, I said this early on, and to my critics, September, October. Even they're saying it now. Dr. Fauci, 2022. You know, it's going to take a time and reimagine the way the new world is. We had to reimagine the workforce, government, how we do restaurants, how we do everything nowadays, and to Catholic Charities to always have to reinvent themselves to still help people in United Way. Great partnerships. And I do want to say to all the kids out there, I do want you to play sports. I really do. And I apologize. I really do. I feel sorry for the decision I have to make. To Hagen and to Mia, who have gotten a lot of garbage from their friends because of me, I apologize. I do. And it's not an easy decision. But when the health of not just children and adults and everyone falls into this category, I'm going to do what's based on science. And Dr. Whalen, she's a doctor. I am not. I'm going to support it 100%. So again, we will get there, but just be patient and help us get there by doing the right thing. Also, our mental health support's available 7 days a week, especially for children and adults. 518-269-6634. Our sexual assault hotline, 518-447-7716. We expanded our hours because I brought the numbers up the other day. Again, the 211 and the hotline for the state, 188-364-3065. Thank you thank you to everyone doing the right thing, and thank you again to the great relationships I have with John, Pat, and Neil. It's a difficult time, and with the legislature, Andrew Joyce and Gary Demolis, Gil Ether, all of them that I deal with. There's a lot that goes on. There's a lot that goes on, and to my counterparts, I was again talking to Steve Newhouse from Orange County last night on these decisions, at 1 o'clock in the morning, and it's the only time we can get together, after a long day of answering all of our calls, and then we just seem to call each other, and I don't want to speak for them, but I think we do a little crying to each other over the phone, saying, hey, it's been a tough decision, tough day. I don't take these decisions lightly, but I will make them. So again, thank you. Be safe out there.